What's next?
You ready for the next one?
I am.
Okay, moving on to number 3. One of the biggest problems, ladies, I know you all hate, cankles. Well, we've got a lady in the audience, Delene, here with us today. Buddy, come on up here. Let's see if we can't try to help you out. All right, let me see. Dr. O, what do you think, sir?
Well, the first thing...
Should we check for edema?
Yeah, we want to make sure that this isn't just swelling and she's not pitting. If this was, her retaining a lot of fluid, it would really pit there. So she has a little extra fat in her ankles that is just keeping from having that nice shape, that transition from her calves to her ankles.
Well, some days better than the others.
Well, it is? Then that means that you may have some fluid retention that you have there. And in that case, you need to go see a doctor and be examined, make sure that you're not retaining salt, that kind of thing, that the circulation in your legs, that there isn't a problem there. But I'm guessing that you also have a little extra fat going on there too, which I can feel. I mean, I can feel when I'm feeling your Achilles tendon here that there is some fat around there. So you can probably offer some help as well.
We start here with me, and the first thing that we want to try to do, like Dr. O said, is we want to try to reduce, if there is water retention, cut the sodium back, eat foods that are high in potassium. A coconut water a day, it has 600 milligrams of potassium and 50 calories. So that's great because potassium helps you flush out excess sodium. If you're a fit woman like yourself and you're already fairly lean, I would suggest something called body sculpting, where we can build the calf muscles a little bit and try to create the illusion of a smaller ankle. Sometimes I do it with weights. We build the upper back to make the waist look a little bit smaller. So I want you to go heavy with these bad boys right here, because when you want to build a muscle, you want to overload it. So you want to go heavy weights for about 3 to 5 repetitions for maybe 3 to 4 sets, 2 to 3 times a week, okay? Grab onto these.
Oh, God.
I know, told ya. Okay, now, all I want you to do, real simple, up and down.
Okay.
That's it. Yep, up and down. And hopefully we can create a bigger calf muscle, illusion of a smaller ankle. But in this particular case, you did wonderful. Now, this is where I have to hand it over, because if reducing the water, if decreasing body fat, if building the calves doesn't solve the problem, I pass over.
We do what's called old-fashioned liposuction. And we have an animation to show you what we can do. With liposuction techniques, tiny, tiny incisions made on the inner part of the ankles. A real small cannula is inserted. We can permanently remove the excess fat in the ankle region, the front, the sides, the back, safely through a tiny, tiny incision, permanently gone. But you said it, Jillian, this is one of the toughest areas of the body. And if you're just genetically programmed to have heavy lower legs, your calves, your ankles, liposuction may be the best way to treat that.
I completely agree. Dr. Warden, awesome tips. Delene, thank you so much for being here.